Hello, everyone. I am delighted to welcome you back to our series of interviews with participants and contributors to the conference roundtable Coronavirus and International Affairs, taking place online on 17 April 2020. Registration is necessary but free. It is my great pleasure today to move us from where we've been looking. We've been looking at China, in the US, we've been looking in Central Africa and in Cuba. Today, I want to take us over to both the Middle East and to Eastern Europe and the old Soviet bloc. And it is my pleasure for that purpose to introduce you to Pini Miretski, who is the Deputy Director, Planning and Program Development Division of JDC. He has over 15 years of experience in an international humanitarian relief organization. In 2014, he received his PhD in international law. It was a brilliant thesis. In international law, in a thesis that dealt with transnational corporations and human rights. He received this from the Hebrew University in Jerusalem. He's also undertaken concentrated training on nonprofit management at Columbia University in New York. Pini has several published articles on the role of non-state actors in international law and human rights. His academic interests focus on international legal theory and the role of non-governmental actors in transnational law. In his working life, he focuses on strategic planning and innovation in the field of humanitarian relief. And with that, it gives me great pleasure to introduce Pini. And I want to start you off with a question. I've been dying to ask this question for a long time, and you're perfect for doing this. Oh, and by the way, sorry, Pini's views represent only his own personal views, not the views of any institution. All right, so here's my question. It's been very interesting to see what appears to be very different approaches to COVID-19 in Israel and in the old Soviet bloc, principally, I guess, Russia and the Ukraine. And I'm wondering if you can speak a little bit to us about how the response to COVID-19 has been developing in those two very different, but in their own way, quite connected places.
So thanks, Larry. Thanks for the opportunity also to talk and to be a participant at this webinar conference. So I actually am quite fortunate to have to be able to see the perspective of both being in Israel and working with different countries, the 11 countries in the former Soviet Union bloc. And while it is often, we're often accustomed to see that bloc as a single unity or as a monolithic region, they're actually not. And they're not in a variety of things. And one of them is definitely their treatment of the coronavirus. So let's start with Israel, where I'm located. So first here, Israel has been taking a very rigid approach in terms of the coronavirus. Rather quickly, we had a lockdown very early in March. The government started first towards the end of February, early March. They started with different steps to be cautious towards the upcoming pandemic, which was then not yet a pandemic. It seemed almost funny at first because while we're a country with a lot of visitors coming in and a lot of businesses being done outside of Israel, so there's a lot of travel, and this was also one of the biggest concern at the beginning, because a lot of people came from abroad, a lot of people went abroad, so that was the first steps that they took. They tried to do significant quarantines, and then rather quickly we went to almost full lockdown. Today, most people are working from home. They're not allowed to leave their homes for more than 100 meters away. Again, except for the urgent places that places which deal with food, medicines, and essential places of work, they still work, but with limited number of people, and generally the country is believing in a more lockdown in a more lockdown strategy. So one thing which is interesting to see in that respect is also the way that we're dealing with that as opposed to the other countries. So let me give you just a couple of things to compare to or compare with. So Ukraine, for one, is a country that very rapidly went to something very similar to Israel. There was a difference of about just 1 or 2 days in the pace, but actually, for example, they shut down almost all public transport very fast. So think about the large cities, large megapolises without the metro and slowly without almost without any public transportation. Only people with special permits can go up on buses and stuff like that. People over 65 there, sorry, over 60 in Ukraine cannot leave today their homes except for essential issues. So this is an example of a country which allegedly, and this is one of the interesting things, allegedly doesn't have a lot of cases, but still has very, very harsh policy introduced very quickly. By the way, one of the things which are interesting, and I think when trying to compare the situation among the various countries, it's important to see how many people are being diagnosed in the different countries. And I think when you look at the different and the number of cases, one of the things that you have to understand first is the percentage of those being diagnosed. And if you don't diagnose a lot, then you can't really compare the number of cases with the different situation or among the different countries. So that's one thing. Another example would be, let's say, Russia. With Russia taking a more, let's say, mild approach, a more cautious approach with the city of Moscow. Russia is generally a federal state, so different cities or different regions have their own governments, and they're introducing different politics or different policies also. So Moscow had today are today in almost a lockdown, and one of the interesting things is that they even introduced technological passes to speak about whether people can leave their homes or not, and only people with those passes can leave their homes for certain reasons. But also one of the interesting things is that the fact that they're also trying to understand whether these tools work through the technology, and they see that it doesn't really work, and that's also one of the reasons that they are using in order to introduce different measures or more strict measures. In other parts of the country, the situation is not necessarily the same. So recently, just 2 weeks ago, the Russian President Putin, introduced a law that gave everybody, that sent everybody to, he defined it as a non-working period, meaning that people don't go to work, and he also urged them not to be out on the streets and not to go, not to refer this as a holiday. Not all did. Meaning that there were still a lot of people on the streets, and that was also one of the reasons that now they're introducing more and more regulations. And different cities have different policies, like I said, different cities, different regions. So it's very interesting to see, again, think about the fact that this is a country which is huge in terms of its scope. It has 11 time zones. It goes all the way from bordering with Japan on the one hand, and being within Europe, actually through the Kaliningrad enclave on the other hand. So it's a huge country. It's very difficult to monitor it, and this is also one of the interesting things there. A totally different alternative would be states like Belarus or Turkmenistan. So just to give you an example, the Belarusian President Lukashenko, has a different view, and he believes that while the state should be dealing with coronavirus, but the overall treatment of it is another psychosis, as he defined it, of the global community. Which is interesting, and again, they are taking measures based on his latest words. There are about 800 people diagnosed with the coronavirus in Belarus, but this is actually one of the examples where almost everything goes on as usual, meaning that they continue to play soccer, they continue to play hockey. Again, per the president, he believes that the coronavirus doesn't stand within when you play hockey. So this is one approach. But it's important to say that they are taking steps. They are just don't believe that this is that the right approach is to handle that in terms of lockdown, because he thinks that the economy is the most important thing, and that's what he wants to keep. Another alternative, another example, which I think is even more, which goes even further away that spectrum in a way, is the example of Turkmenistan. Turkmenistan is again another state, a republic, which came out of the former Soviet Union, and there the president decided that they don't want so they don't want to use the term coronavirus a lot. There were some news in the mostly Western media that they banned the term coronavirus, so it's not true. They didn't ban it, but they are censoring it very significantly, and they don't want to spread panic as they define it. So I know that Larry spoke a little bit about the semiotics in one of his previous presentations, so this is naturally a clear connection to that regard. So this is interesting, and again, it's very interesting to see the full spectrum of the different approaches, different things, different ways that people are treating, the governments are treating. And again, given the fact that those countries are also federal, so there is a difference not only within the country, but also per the most of the regions. So again, I have the good fortune to work with different states. So we are seeing really a wide array of different approaches.
All right, excellent, excellent. Thank you very, very much. That was really interesting. But you'd mentioned something, and I hope to maybe get you to speak a little bit more about this, if you could. And that is the question about technology. You'd mentioned it in passing, both in Israel, I guess, and in Russia. And I was wondering if you can actually talk a little bit about what kinds of technological innovations are being used. And my understanding was that it's in its most interesting phases in both the Israeli and in the Russian context. And to what extent has there been any discussion about its use within the constitutional systems of each country?
Thanks. So yeah, that's actually a great question, and thank you for that opportunity. So I think that let's start with Israel. I'm closer to this region still. So in Israel, there are different. So Israel is considers itself as a startup nation in many ways. So we have a lot of startups, different startups in the country, and the government actually takes a lot of initiatives in terms of technology, particularly with regard to Corona. So first, I have to say that Israel is in a special situation right now, since our country was not able, at least up to today, unless I didn't hear the news, to form a solid government, and we already had 3 elections within the last year. So we are in a special situation where we do not have a legitimate government at this stage. We have a transition government, and that's important in terms of what I will speak to a bit later. So what our government decided, again, the way that it works in Israel in terms of politics is that as long as you don't have an elected government, you have a government which stays until the elected government will be selected, and it has limited rights. And it's important, again, to discuss the things that we're discussing. So almost immediately when this occurred, so we had basically in Israel two ways or 2 avenues in which the field went. So one, there was a lot of development or a lot of people working on different solutions to Corona, both in terms of trying to find the best ways to best checks, how can we know that it's Corona, as well as trying to find different medicines for Corona, vaccinations, different aspects, and there's really a lot of work in the startup startup and innovation sector in Israel in terms of COVID-19. And there are whole maps that are telling you different issues. One of the other avenue was the things that were introduced by the government, and there are different aspects of the government in that regard in order to try to combat that. So one of the first things that happened is that our health ministry worked with a company that through our security agency decided to try to allow our security agency to try to understand through the cell phone data whether any people were in contact with known COVID-19 infected people. So basically the concept is that they wanted to give access to all of the data of all of the cell phones of, think about it, all the places where they were to a security agency. So naturally, and again, and this is within the fact that there is no elected government, and at that stage there was no parliament also able to discuss this. So naturally, this very fast, this went to the High Court of Justice, which said that this is needed, but there must be a parliamentary overview of this possibility. And unless that parliamentary overview will be introduced, then this supervision must stop. Because this is highly damaging to the human rights of the people. And so it clearly limited the possibilities to the coronavirus period. But again, the political or the parliamentary overview was important. So a couple of days later, we had at least some kind of parliamentary overview. So at this stage, it continues, but to a limited scale. However, it's not the whole story, because in addition to the health ministry, also other ministries in Israel decided they want to have their own technological tools that will overview also different aspects of the corona. So today we have several either applications to the mobile phones, as well as tracing by the special security agency, as well as some private initiatives that are done by different institutions that are also suggesting or advising you on whether you might have coronavirus or whether you should be checked and so on. So it's interesting. At this stage, this is still a very interesting topic, which is continuing. By the way, other countries allegedly also wanted to get Israel's different applications, mobile applications, to try to introduce them in their countries, which is interesting. In other countries, so if I'll give you the example of Russia, so starting yesterday in Moscow, like I said, they introduced electronic barcodes that are given to the people. They are sent to their mobiles, and through that actually gives them the possibility to go out on any kind of transportation. So at this stage, you don't need them to walk, but you do need them in order to go on public transportation or to go even with your car somewhere. One of the things that it created, by the way, is significant lines and crowds, because somebody needs to check those passes. So this is one of the negative aspects of that. They are trying to come up with different solutions, where one of these solutions is actually to try to monitor that over the surveillance or video cameras spread throughout the city. So again, thinking about the different human rights aspects or the right to privacy and so on. So this is interesting, and there are different considerations in that. I must say, however, that that technology is not only used in terms of surveillance or as an alternative to try to find a cure or a vaccine for the disease. There are also a lot of positive aspects in terms of technology. So one of the things that we're seeing is that we're seeing a lot of different aspects of technology or technological advances that are done in order to enable, let's say, the elderly who are staying at home to try to be more approachable with their surroundings. How can we work remotely more efficiently? How can the different aspects of, let's say, I'll give you an example of something that has to do uh, with social care or home care to the individuals. One of the things that is done, let's assume that you have somebody who is either a patient or somebody that you want to care for away from home. So one of the things then is, how do you approach that patient if he has, for example, if he has, if he's COVID-19 positive. So one of the things employed in Israel in that regard are robots that are being used in order to try to measure the temperature, in order to try to see the basic situation of the client, because most of the things do not require physical presence. So there's a lot of intervention going in there. We, as an organization, also published a call for different aspects that will assist us with remote supervision, remote communication, remote monitoring of the situation of the clients. Now that personal contact is a lot more problematic, so we need that technology in order to be able to use it. And we do see a lot of positive developments in that regard as well.
All right. Well, thank you. That is just fascinating. Our time is rapidly coming to a close. I was wondering maybe if we can close our discussion. There's so much I want to ask, but we've got a limited amount of time. I wonder if maybe you can close off by you spoke about positive outcomes from this in this horrible situation. And I was wondering if in that context, you can talk about the way in which COVID-19 has had an effect on volunteering and on non-state activities of people to help each other.
Yeah, thanks. This is actually an interesting thing, and one of the things that we say is that not every crisis has also an opportunity. It has also something that needs to be developed. There's also that saying of the fact that Newton also developed a lot of his work during pandemic in a way, during a lockdown, and it's also something that should give us a way forward and something to think about when we're stuck in this situation. So one of the positive things that we are seeing, and this is something which I think is pretty strong around the globe, is that different aspects of self-help or people volunteering more is coming up more strongly. So we definitely work with volunteers, and we see that a lot of people are coming together and doing whatever they can to try to have different people within this period. So like I said, in Ukraine and Russia, for example, people over a certain age cannot leave their homes today. So there's a lot of organizations, including ours, that work on providing people with basic foods, people who are calling the elderly and being in contact with them almost daily through the telephone lines or the internet or any other way. It's really heartwarming to see the people who are doing whatever they can to let's say do 3D prints of masks or different protective gear and give it to the health teams around the globe. It's really, there are different initiatives in order to how to contact the elderly. And this is also another thing that is important. The elderly population are being, people understand that the elderly population is an important aspect that we need to focus on in a way. People are trying to think about them, and people are giving different perspectives and different answers to them. And it is important, think about it, the global population is aging rapidly. The issue of aging is the central problem in the world, and it is going to be the same looking forward. And the fact that we're understanding this now, and the fact that the COVID-19 is helping us focus on these populations is very, very important. And it's good that there are different solutions that are being developed now in order to try to assist those populations around the globe. So this is a very positive development. Another positive development is the fact that if you look around the globe, think about the social networks or the social support that even the countries are introducing. So even countries which do not have, let's say, policies or are, let's say, to the almost extreme of the capitalistic system and don't believe in any kind of social networks, they are trying to introduce different laws that are supposed to provide support. Countries with no health, where health is usually paid, are providing in fact different solutions for the COVID-19 patients, also because they understand that this is a global pandemic. And this is also something which also gives us hope in a way to the in looking to the future, with maybe the hope that the different countries will try to understand also the importance of the social networks that there are for different peoples, and that there are times, regardless of the question, what is your perspective in terms of economy, in terms of politics, that you need to be more flexible, that you need to be more innovative, and that you need to be able to provide solutions that support that in order to be able to assist and continue your way of life.
Right.
So
Well, that
I
is
think that's
brilliant, brilliant. Thank you so, so much. And I'm afraid that our time has run out. There is so much more that we can ask Pini, and he will be available to us on Friday during the course of our conference. Please register, come ready to ask questions, send us questions beforehand. We'll be happy to tackle them during the course of the session. Pini, thank you so, so much for sharing your wisdom and experience with us, and we will see you again soon.
Thank you, Larry. Bye.